Yes, this is the early data or phase 1-2 study of new cellular therapy trying to treat the relapse post-transplant, which is very challenging and very difficult medical problem. So this is the innovative strategy what we try to conduct based on previous biology to understand, can we use these cells to prevent the relapse, and why do they work, and why did they fail, and how we can use them in a better way in the future. One of the main challenges, despite many good things of new cellular therapy, are the costs. They required extensive gene modulation and growth, and which carry substantial burden to the payers or to the patient. So our idea was to develop something which is relatively inexpensive, which allows quick turnaround without much cost and without much regulatory oversight, because it does not require gene editing or gene therapy, so we can provide it quicker to the patients, which ultimately, if it ever works, can help the patients outside of the more advanced or rich countries and payer systems. We usually divide relapses in early relapse and late relapse. Unfortunately, early relapse have the worst outcome, because if you relapse very early after transplant, just because of the biology and the new technology, we tested this only in the patient who have a late relapses, meaning more than 6 months or a year post-transplant, versus there is a whole other question, can we use these cells to treat early relapse, and can we also prevent the relapse? I think these are interesting biological questions that we want to look next, and this is the difference what we have done in this study, that we have focused on the late relapse. So first thing, we are trying still to complete biological study, because it's always important when you do something and when you do it in a patient to understand how it works biologically. So the next question is how we can grow these cells better so we can achieve better product. And then it might even come the question, do we need to do some additional modifications, even genetic modification, to make them as a more potent or more sustainable therapy? But this was just very early phase 1-2 data to test some new concept and learn the biology in patients who are relapsing after haploidentical transplantation.